Hi everyone, for the seventh small group discussion, I would like to present our student project entitled Depression and Suicide in Psychiatric Emergencies. First, let me introduce myself. I'm Katarkan Kamila with Lesser December 009. I would like to start the presentation by explaining the background of this student project. So depression is a complex psychological disorder characterized by persistent mood dysregulation. The prevalence of depression itself reaches 3.8% of the population, and it is estimated about 60% of its cases experience misperception, which lead to improper or delayed management and the worsening of its prognosis. Depression that is not treated properly has the potential to lead to suicidal thoughts and behaviors. About 95% of people who commit suicide also suffers from depression. Globally, at least 800,000 people die every year from suicide. Suicide is an emergency situation that requires early intervention because this condition can cause lethal complications. However, currently there are so many gaps when it comes to suicide management and interventions. There are several problem formulations of the student project, namely, what is the definition, epidemiology, etiology, risk factors, pathophysiology, clinical manifestations, diagnosis, treatment, complications, and prognosis of depression and suicide in psychiatric emergencies. There are also several objectives of the student project, which are to understand the definition, epidemiology, etiology, risk factors, pathophysiology, clinical manifestations, complications, diagnosis, treatment, and the prognosis of depression and suicide in psychiatric emergencies. And the benefit of writing the student project is to enhance the knowledge and understanding of depression and suicide in psychiatric emergencies, which furthermore, the student project is also expected to be a reference for future research related to depression and suicide in psychiatric emergencies.
Hello, doctors and friends. My name is Yovita Theodora Liu with last three digits 114. Now I'll explain to you about the definition. Depression is a major mental health disorder that comes from intricate disruptions in psychological, neurological, immune, and endocrine systems. Over time, depression may also involve in an inability to feel pleasure, cognitive impairments, alterations in sleep and eating patterns, trouble concentrating, and suicidal thought. Suicide is the act of intentionally ending one's own life. It has become a major global public health issue and impacts individuals of all ages. Suicide frequently stems from mental health disorders, overwhelming distress, or profound feelings of hopelessness.
Okay, my name is Vitakia Ibn Agustia with the SGD 05, and I want to explain with the epidemiology. According to the WHO, depression affects 3.8% of the global population, including 5% of adults and 5.7% of the of its over 60, totaling approximately 280 million people. Women are more affected by depression than men, and meanwhile in Indonesia, the prevalence of depression in people is over 50 years, which is around 6.1% of the population, equivalent to approximately 11 million people. Superdepression increases the likelihood of self-harm and suicide, with 80 to 90% of suicide cases being linked to depressions. Every year, approximately 800,000 people die from suicide globally, equating to one death every 40 seconds. And WHO estimates the global annual suicide mortality rate at 10.7 per 100,000 individuals, and completed suicides are 2 times more common in males than females. However, for suicide attempts, the ratio is reversed. Meanwhile, in Indonesia, it's estimated that there are 10,000 cases of suicide annually, approximately one suicide every hour.
Hello everyone, my name is Fiona Natania Santoso with my last three digits student number ID are 249. Now I'll explain the etiology of depression and suicide in psychiatric emergencies. So depression and suicide have multifactorial etiologies involving biological, psychological, and social factors. From biological, depression is linked to chemical imbalance in the brain. Depression occurs when the brain has excess or deficiency of neurotransmitter. And from genetic studies have been shown that depressed suicide victims have fewer serotonin in some areas of their brains, and it can result in symptoms of depression such as sadness, emptiness, worthlessness, overeating or loss of appetite, insomnia or hypersomnia, restlessness, lack of energy, and irritability. And from neuroimaging studies have been identified structural and functional changes in specific brain areas are associated with increased suicidal vulnerability. And from the social and psychological factors, certain personality traits and characteristics may predispose individuals with major depressive disorder to develop suicidal ideation, suicidal attempt, or commit suicide. And individuals who are more socially connected are less likely to commit suicide. Depression is often triggered by adverse life events such as mourning, chronic illness, trauma, breakup, or unemployment, and it may lead to hopelessness, impulsiveness, and low levels of self-directedness, which may lead to suicide.
Now, we will move to the chapter 2.4, which is the risk factors. First of all, my name is Jeremy Nathaniel Haja with the number 26. Major depression and suicide are significant community concerns, particularly in psychiatric emergencies. Identifying and understanding risk factors are essential for early intervention. Genetic and biological factors such as family history of depression and changes in neurotransmitter like serotonin are significant contributors. Psychosocial factors, including major life changes like bereavement and chronic stressors like financial problems, also play a crucial role. Individuals with poor social relations are more likely to experience depression and suicidal thoughts. Comorbid mental disorders such as anxiety and bipolar disorder further increase the risk. And demographic factors, including age and gender, and show that docents that young adults and the elderly are particularly vulnerable, with females more likely to experience depression and males more likely to commit suicide. Socioeconomic status is another critical aspect, as those from the lower backgrounds face more stressors and have limited access to healthcare. Chronic medical conditions like cancer and cardiovascular disease also elevate the risk due to feelings of hopelessness and despair. Understanding these factors is vital for effective early intervention and
Hello everyone, my name is Gregor Nuratama with last three digit of student number 085. And now I'm going to explain about the pathophysiology of depression and suicide in psychiatric emergencies. Several mechanisms are thought to be involved in depression pathophysiology. Neurotransmitters as well as serotonin deficiency could lead to depression. Moreover, altered levels of dopamine, GABA, and glutamate are also shown to affect someone's brain function in determining anxiety, motivation, and reward systems. Other mechanisms include hypothalamic pituitary adrenal and condyle axis, and these mechanisms include the role of CRH and ACTH and are contributed by estrogen and progesterone in women. Genetic and epigenetic modifications are also shown to have a significant role in someone's tendency to depression state. The story of the family with depression and 5-HT2A receptor gene detection could influence how easily someone falls into depression. Lastly, metabolic systems abnormalities such as shifting gut microbiome or unusual levels of glycine, glutamate, citric acid, glucose, cytosanoic acid, and cholesterol could be related to depression. Furthermore, negativity and pessimistic thoughts that exacerbate due to depression could induce harmful acts, including suicide attempts.
My name is Fernando Gosali and my digit of student number is 036. Now I'll explain about the clinical manifestation of depression and suicide in psychiatric emergencies. So the clinical manifestation of depression in psychiatric emergency, the first one is emotional distress, pervasive sadness, hopelessness, worthlessness, and anhedonia, loss of interest in previously enjoyable activities. And for the physical symptoms, there are sleep changes, could be insomnia or hypersomnia, appetite and weight alterations, and then cognitive impairments, which is difficulties in concentration, decision making, and memory, and psychomotor changes, which is agitation or retardation, restlessness, or slow movement. and the risk is elevated risk of suicidal ideation and behavior. And the clinical manifestation of suicide in psychiatric emergencies, there are verbal cues expressing desire to die, preoccupation with death, and behavior signs, suicide planning, acquiring means, giving away possessions, social withdrawal, marked withdrawal, decline in self-care and responsibilities, and mood changes, sudden calmness or euphoria.
Hello, my name is Dia Chalista with Relation number 129, and we'll move to the diagnosis. A diagnosis of depression is made on the basis of a clinical history provided by the patient and a mental status examination. A comprehensive clinical interview shall encompass an in-depth examination of the patient medical history, family history, social history, and substance use history, along with a detailed analysis of the presenting symptoms. A comprehensive psychical examination, inclusive of a neurological assessment, is imperative. The investigation of depressive symptoms commences with an examination of neurovegetative symptoms, which encompass alteration in sleep patterns, appetite, and energy levels. And despite the absence of objective diagnosis for depression, routine laboratory assessment may include complete blood counts with differential, basic metabolic studies, thyroid function, and assessment of vitamin B and folate levels. In primary care setting, the Patient Health Questionnaire 9 or PHQ-9 is a widely used instrument that employs 9 items that correspond to the DSM-5 criteria. It's commonly employed for the purpose of screening, diagnosis, and monitoring treatment response. The PHQ-9 generates a score between 0 and 27. A score of 10 or above is indicative of a potential diagnosis of major depressive disorder. And it's important to assess all patients with depression for suicidal risks. Patients should be checked for suicidal or homicidal thoughts at each visit. If there's a risk of suicide, it needs to be addressed quickly. The Joint Commission suggests using the X-suicide screening question as concise screening instrument for the identification of suicidal ideation in outpatient setting. And this is an example for the diagnostic tools. In the left is Patient Health Questionnaire 9, and in the right is X-suicide screening questions.
Hello everyone, my name is Priscilla Wijaya with the last digit name is 36 and I will explain 2.8 Treatment and Management. The effective management of depression and suicide in psychiatric emergencies necessitates a multi-phase approach that incorporates immediate medical abbreviations, evidence-based pharmacotherapy, and structured therapeutic interventions. Establishing a stable therapeutic alliance with the patients, delivering timely medical care, and addressing the underlying psychopathology are critical components of this approach. Clinicians and patients should work together to create effective plans. It generally involves the first one, clinicians recognizing warning signs of suicidal behavior. Second one is engaging in coping activities such as relaxation and distractions techniques. Third one is identifying social situations that can offer distractions. The fourth one is listing contact information for personal support systems in times of crisis. The fifth one is recording phone numbers for professional help and emergency services. And the last one is outlining steps to make the environment safer, such as limiting access to firearms and access medications.
Okay, greetings, doctors and friends. My name is Abel Manuel Senipar with three last digit of student number 118. Now I'll be explaining about the complications. So the negative influence of depressions can extend to a person's physical health as well, creating a complex and often a debilitating cycle. A study published by Gupta focused on patients with heart failure and found that they were significantly more likely to develop depressions and even engage in suicidal behaviors. This research highlights the need for a more integrated approach to healthcare, where both mental and physical well-being are addressed simultaneously. For instance, incorporating mental health screening and potentially therapy sessions into routine checkups for chronic illness like heart failure could be a valuable step towards preventing these devastating complications.
My name is Tiffany Cecilia with real digit number 170, and now I will explain about the prognosis. Quantifying the morbidity associated with depression poses a challenge. Nearly all individuals who die by suicide have a diagnosable mental disorder, often accompanied by substance abuse, which frequently represents an attempt to self-medicate for depression symptoms. About two-thirds of those who complete suicide had consulted a physician within the month preceding their death.
And now let's talk about the conclusion. My name is Deoputo Aditma Pradyana with 3 digits to number 178, and I will tell you about the conclusion and suggestions. So, for the conclusion, depression is a complex disorder involving disruptions in psychological, neurological, immune, and endocrine systems, and suicide is closely linked to depression, and it is a major global issue that we need to assess. And it is caused by multifactorial involving genetics, biological, psychosocial, and environmental factors. And the diagnosis involves patient history, mental status examination, and screening tools like the PHQ-9. And effective management requires a multi-phased approach, including pharmacotherapy, therapeutic interventions, and safety planning. And also for the suggestions for our presentation, to tackle the public health challenges of depression and suicide effectively, a comprehensive approach is essential. And this approach should prioritize early intervention through routine mental health for each individual, and public awareness campaigns and education programs play a crucial role in reducing stigma and promoting help-seeking behavior, and increasing awareness of depression and suicide signs so that we could tackle these issues more forward in the future. That's all for our presentation for today. Thank you so much. Terima kasih. Om Santi Santi Santi.